The reproductive justice movement, which emerged in the late 1980s, was led by Indigenous women who felt that they had no control over their reproductive choices. Reproductive justice refers to the right to have children or not, and to parent them in a healthy and safe environment. Since the 1980s, the movement has been examining the ways in which environmental racism and other structural inequities compromise women's reproductive rights. Therefore, addressing reproductive health issues must take a human rights-based approach. I would now like to provide a few suggestions for addressing child and maternal health issues affecting Indigenous, Black, and other racialized women through a human rights-based approach, given that poor child and maternal health outcomes for these women are often outcomes of structural inequities within society and within healthcare settings, more specifically. So first, it includes analyzing our power systems. And these power systems, as we know, within society and within our social structures, whether they be education or labor, employment, and criminal justice, they're premised on gendered, sexualized, and racialized acts of dominance in daily life and within these social structures. So it means that we have to understand how these power systems compromise maternal health. And we have to understand that these power systems are interlinked. So it requires an analysis and an intersecting analysis where we look at the intersections of race, culture, gender, disability together, how these issues converge to shape health outcomes. A human rights-based approach also involves addressing topics of racialized women's maternal health. And those topics must be included in discussions on reproductive justice. And which I said earlier, reproductive justice can be defined as the right to maintain personal bodily autonomy, have children or not have children, and parent them in a safe and sustainable environment. Next, facilitating healthy occupational and environmental conditions is key. And this includes addressing environmental racism by incorporating racial equity considerations into how we regulate polluting industries, what we consider to be part of an environmental impact assessment, which is a tool that's used to determine where we place a particular industry, and permitting decisions. It also involves ensuring that healthcare resources, goods, and services are distributed and accessed based on a model of equity. That means that we're trying to make sure that everybody has equal access to the goods and resources that we take for granted in society. And those goods and resources, once again, could be, the right to clean air, water, and soil, good education, good transportation, all those structural factors that we all need to have access to. We also need to address racial bias, stereotypes, stigma, discrimination, and disrespect in healthcare encounters. And we know in Nova Scotia and more broadly in Canada, racialized women often share their concerns about their treatment in healthcare settings. Whether it's implicit bias or more broadly structural inequities, there tends to be an underutilization of health services, particularly in Nova Scotia, among Indigenous women and other racialized women because of their experiences, negative experiences within the healthcare setting. A lot of this also has to do with access to information. Providing women, particularly women in rural communities, women who are underserved in various ways, women with low education, who often don't know how to access information on their various healthcare choices. So when we talked earlier about looking at all those intersections, we have to look at how race, particularly in this province, and culture, and education levels, and socioeconomic status may actually prevent women from getting the kind of information that they need in order to make healthy choices with respect to their health and mental health. We also need to encourage human rights education and outreach to racialized women on their sexual and reproductive health and rights.